morning, everybody. My name is Adam Stokey with SLD Technology. I'd like to welcome you to our Portland, Oregon showroom. We have some resetting here we're doing, but I know you guys are here to talk about safe patient handling today, but I wanted to kind of talk about our systems and how they integrate with the safe patient handling. In our mock-up OR here, you have what you see in front of us is the SLD flagship product, which is the SLD AirFRAME. It is a fully integrated modular OR ceiling that includes all of the air delivery system for the operating room, all of the lighting over the patient table, as well as structural supports for the equipment, lights, and booms. We also have a new system integrated into the airlift on the structural side. It's called the airlift, excuse me. It is basically a patient lift that has the rails integrated into our airframe. So what I'll show you here is typically it's parked over in the corner of the room. It stays out of the way and in the corners, so it's away from all of the lights and booms and the surgical staff. But when it's needed, you can drag it into the space, bring it right in over your stretcher, drop it down to allow for a safe patient transport from your stretcher to your surgical table. So our team here at Infinitus is here today with us, demonstrating their product. We're going to show you guys a live presentation or a live demo of transferring a patient from the stretcher to the surgical table. So I'm going to ask my team to come on in right now, and we will go ahead and show you guys a live demo of how we're going to move a patient from stretcher to patient table. My counterpart Marty here is going to talk about their system, how it integrates with our patient lift, and how we're going to move from stretcher to surgical table.
Yeah, I'll show you the parts and pieces, and then I'm going to let David kind of do it as we're doing a whole demo. So what we have here today is our Genesis Trendelenburg lift and positioning system. It's a foam pad. It allows us to get 100% skin to pad contact on the patient as we move and go into Trendelenburg. It has bi-wings, so these are arm adduction systems that are built into the pad itself. And we'll talk about flexibility with that just a little bit. We have the Azul, which is a head positioning system that goes with our pad, works really well with the pad, and that helps your patient as we're going into Trendelenburg be comfortable through the procedure. And then we have a lift kit on here, which is basically a lift bar on both sides of the pad, and then we have straps that will go along with it it helps us integrate with the airlift. So we'll go ahead and load up a patient and show you how it works. I'll hand off to David. Ready?
Yeah. All right, right behind you, Marty. We're going to bring the patient lift in first.
Okay.
Position it right over the center of the stretcher here, and we'll take it up.
Yeah.
Okay. Perfect.
We'll mention the carrier bar. For the demonstration, we just have a two-handle carrier bar. Normally we would handle a 4, and that would have an additional system on here that would help us lift the legs, so we don't have to have a person do that. So go ahead and connect the straps. Ready to lift?
We are going up.
Okay. Transfer over to the surgical table.
Okay. So, one of the benefits of this Trendelenburg system, unlike other systems, is other systems are tethered at the distal end of the table when lithotomy is required, and then we got to figure out how we're going to get that patient down there. One of the things that we designed this pad for is to standardize all of these processes from airway management to arm adduction. So I always want my patient up here from an anesthesia perspective so I can maintain and manage that airway, especially with larger patients because they're going to potentially desaturate faster or have difficult airways. So we would start here at the top of the table. We would put arm boards on just like anything else. We would manage the airway. We would intubate the patient. We would then go ahead and start a secondary IV or do whatever if we needed an A-line or something like that. Once we got all of that stuff done, then we would move into the second phase. We're moving that patient to lithotomy. So we put their arms right back up here. These wings, when it's lifted, will keep their arms from kind of flopping out. So we're going to simulate movement down to a lithotomy position.
Bring them out there.
Okay, so let him drop. And he's kind of a tall guy, but this is a 45-inch torso section. But if you can see from where his head is and where I would be, I would have to reach and try to intubate that patient on a daily basis. If we had a shorter patient, it would even be more so. So we're going to move that out of the way, and then we'll move to the next process. There we go. We'll slide the bars out here. Go. Thank you. And bars out. Here's this. So the next phase that we'll do is we're going to go ahead and strap the patient to the table. There we go. So you're going to strap the system to the table via its strap. Okay. And then next, we're going to tuck the arms. Typically, everybody does a sheet method where we're rolling patients back and forth and then using the sheet to tuck the arms. And sometimes they'll rotate and put gel or foam around that. We have bi-wings. They're very unique. The bi-wing doesn't allow you, you don't have to roll patients back and forth. Basically, someone would pull from that side and we would tuck the system in like so, make sure their hands are in the correct anatomic position, and then we would drop that system. That's it. And we would do the same on this side. The good thing about this Genesis bi-wing is we can actually, there's a Velcro strip underneath where we can actually move the lower wing to accommodate for patients with longer arms, so we can customize fit for every a patient anatomy that we have. And that's all we do. So we've standardized that approach. Now we're going to put a chest pad and a chest strap on. So the reason why we designed this product is we wanted to do the same thing each and every time from a highly reliable perspective across a wide BMI spectrum, so we can make sure that everybody in the room is doing the same thing every time, to reduce the variance that's needed to care for our patients. You want to get 2 fingers in there, so that way you still have good thoracic expansion when we're, when we're ventilating our patients mechanically. And then we will do a Trendelenburg test. Are you ready? Ready. He's been doing this all day, so I'm sure he's ready to. I think we're losing battery. Oh, all right, we'll get it. So you'll see he's fully supported. You got 100% pad to skin contact surface on that pad because that's what holds your patients in place, no draw sheath. His head naturally moves in this area, so that way you don't have independent movement of the head and shoulders against the shoulders, so that way you don't increase your risk for brachial plexus injuries. And you see his shoulders are nowhere near this. And so that is it.
Fantastic. How you doing down there, Steve? Doing great. Thank you so much.
No worries. Thank you, Kevin. Thank you all.
Well, thank you guys for coming by this morning. If you have any questions on the SLD airframe, the SLD airlift, or the Infinitus patient positioners, feel free to drop your questions in the chat. And thank you for your time today. Appreciate it.